Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is plasma protein. Today we will discuss about introduction, normal values, separation, properties, origin, function, plasmapheresis, and variation in plasma protein level. So first of all, if we introduce plasma protein, then there are three plasma protein present in blood. One is serum albumin, one is serum globulin, and fibrinogen. Why the term serum is used before albumin and globulin? Because these are present in serum, but the fibrinogen is not. What are the normal values? Total protein level is 7.3 gram per dl in our blood, but it may range between 6.4 to 8.3 gram per dl. And the quantity of serum albumin is 4.7 gram per dl, and globulin is 2.3 gram per dl, and the fibrinogen is 0.3 gram per dl. You must remember one thing: the ratio between albumin and globulin is 2 is to 1. That's why it is 4.7 and 2.3. If you calculate, it is albumin is 2 times more than globulin. So the ratio between albumin is to globulin is, or AG ratio is 2 is to 1. Now separation of plasma protein, these are practical part. We will not discuss about this part very clearly because these are the part of practicals. If we just take the names only, there are some method like precipitation method, salting out method, then Cohn's fractional precipitation method. Like this type of procedure may be followed to separate them. Now we will discuss about properties of plasma protein. The molecular weight of albumin is 69,000, globulin is 1,56,000, and fibrinogen is 4 lakh. Thus, the molecular weight of fibrinogen is greater than that of the other two proteins. Now, oncotic pressure or colloidal osmotic pressure. So, what is this? Plasma proteins are responsible for the maintenance of oncotic or osmotic pressure in the blood. Osmotic pressure, which are exerted by the proteins in the plasma, are called colloidal osmotic pressure or colloidal oncotic pressure. The normal value is 25 mm per Hg, and albumin plays a major role in exerting the oncotic pressure as it is in more quantity. Specific gravity of plasma proteins are 1.026. Then the buffer action, as these proteins accept hydrogen ion and help in buffer action, and it has a major role because plasma proteins have 1/6 of total buffering action of the blood. Now we will discuss about origin of plasma protein. In case of embryo, in embryonic stage, the plasma proteins are synthesized by the mesenchyme cell, and the albumin is synthesized first. Then the other proteins are synthesized later. In case of adult, these plasma proteins are synthesized in the liver, mainly in reticuloendothelial cells or RE cells. The plasma proteins may also be synthesized from spleen, bone marrow, disintegrating blood cell, and general tissue cells. And the gamma globulin is synthesized by B lymphocytes. Now we will discuss about the functions of plasma proteins. Plasma proteins are very essential for the body. So now the functions. One is role in coagulation of blood. All of us we know that fibrinogen is very much important for coagulation of blood. If fibrinogen is not present in your blood is unable to coagulate. Then role in defense mechanism of body, especially gamma globulin play a major role or important role in the defense mechanism of our body by acting as antibodies or immune substances. These proteins are also called immunoglobulins. Antibodies react with the antigens of various types of microorganisms which causes disease like diphtheria, typhoid, streptococcal infection, mumps, measles, hepatitis, rubella, influenza, polymyelitis, etc. Then role in transport mechanism. In the transport mechanism, plasma proteins have a great role. Such albumin, alpha globulin, beta globulin are responsible for transport of hormones, enzyme, etc. And alpha and beta globulin also transport the metals which are essential for our body. Next, role in maintenance of osmotic pressure in the blood. At the capillary level, most of the substances are exchanged between the blood and tissues. So these are maintained by osmotic pressure. How? Because of the larger size of the plasma protein, this cannot pass through the capillary membrane easily. They remain in blood generally. So, in that condition, in the blood, this protein exerts some pressure which is known as colloidal osmotic pressure or colloidal oncotic pressure. The normal value of osmotic pressure is 25 mm per Hg, which are exerted by plasma protein in the capillary membrane. As the concentration of albumin is more than the other plasma protein, that's why it exerts the maximum amount of pressure. Now, importance of osmotic pressure. What are the importance? And Starling hypothesis. Osmotic pressure exerted by plasma proteins plays an important role in the exchange of various substances between blood and cells through capillary membrane. Now, what Mr. Starling saying is the net filtration through the capillary membrane is proportional to the hydrostatic pressure difference across the cell membrane minus oncotic pressure difference. So what is this? The net filtration rate is dependent on what? It is dependent on the hydrostatic pressure difference between the membrane minus the oncotic pressure difference. So how the much amount the pressure, the much amount of product will bypass through this membrane. Now, role in regulation of acid-base balance. Plasma proteins, especially albumin, play an important role or major role in regulating the acid-base balance in the blood because the virtue of their buffering action and plasma proteins are responsible for 50% of the buffering capacity of the blood. Now, role in viscosity of the blood. Plasma proteins provide the viscosity to the blood, which is important to maintain the blood pressure. Albumin provide maximum viscosity than other plasma proteins. Now, role in ESR or erythrocyte sedimentation rate. Globulin and fibrinogen accelerate the tendency of Rolex formation by the blood cell or red blood cell. Rolex formation is responsible for ESR, which is important for diagnostic and prognostic tool. Now, role in suspension stability of red blood cells. During circulation, the red blood cells remain suspended uniformly in the blood. This property of RBC is called suspension stability. And globulin and fibrinogen help in the suspension stability of the RBC. Now, role in production of terrephone substances. Terrephone substances are necessary for nourishment of our tissue in the culture, and these substances are produced by leukocyte from the plasma protein. Role as reserve protein. When a person is in fasting condition and if the patient is taking inadequate food and inadequate protein substances, then the plasma proteins are utilized by the body tissues at the last source of energy. Then the plasma proteins are splitted into amino acids by the tissue macrophages, and amino acids are taken up by the blood and distributed throughout the body from cellular protein molecules. Because of this, plasma proteins are called reserve proteins. Reserve proteins. Now, plasmapheresis. What is plasmapheresis? First of all, this experiment was done by Mr. George Whipple. That's why it is also called Whipple's experiment. So, plasmapheresis is an experimental procedure done in animals to demonstrate the importance of plasma proteins. So, which is the experiment that is done on the animals for demonstrating the importance of plasma protein? This is plasmapheresis or the Whipple's experiment exerted by George Whipple. What is the procedure? Plasmapheresis is demonstrated in dogs. First of all, from the body of the dog, all the blood are completely removed from the body of the dog. Then RBC are separated and plasma are also separated. Then these are washed with saline and reinfuse the RBC and the all blood cells into the body of the dog with a physiological solution called Locke's solution. And then due to sudden lack of proteins, the animal undergoes a state of shock. But if the animal is fed with sufficient amount of diet containing sufficiently high quantity of proteins, the normal level of plasma proteins is restored within 7 to 8 days, and the animal survive very clearly. The new plasma proteins are synthesized by the liver of the dog. Now the same experiment is repeated, but the liver is also removed. When this process is done, then if the dog is fed with high quantity of protein but the plasma proteins are not made properly, then the sufficient persistent shock is not maintained by the dog, and the dog becomes dead. Thus, the experiment plasmapheresis is used to demonstrate one, importance of plasma proteins for survival and synthesis of plasma proteins by the liver. Now, clinical significance of plasmapheresis and their therapeutic plasma exchange. Plasmapheresis is used as a blood purification procedure for an effective temporary treatment of many autoimmune diseases. It is also called therapeutic plasma exchange. In case of an autoimmune disease, the immune system attacks the body's own tissue through antibodies. The antibodies are also protein in nature that circulate in the bloodstream before attacking the target tissues. So, plasmapheresis is used to remove these antibodies from the blood. So, what is the procedure? First of all, the venous blood is removed from the patient and blood cells are separated from the plasma by equipment called cell separator. Then, this equipment works on the principle of centrifuge. An anticoagulant is also used to prevent the clotting of the blood when it is removed from the body. After the separation of blood cells, the plasma is discarded and the blood cells are returned into the bloodstream in the patient by mixing a suitable fluid or saline and sterilized human albumin protein. Now, what are the uses of plasmapheresis? As the plasmapheresis is used to remove antibodies from the blood, it can only remove, it cannot prevent the production of antibodies from the immune system. So, it can provide only a temporary benefit of protecting the tissues from antibodies. But the patient must undergo for repeated session of this treatment. Plasmapheresis is an effective temporary treatment for following diseases like myasthenia gravis. What is this? Or it is an autoimmune disease causing muscle weakness. Then thrombocytopenic purpura. It is a bleeding disorder. Then paraproteinemic peripheral neuropathy. It is dysfunction of peripheral nervous system due to an abnormal immunoglobulin called paraprotein. Now, chronic demyelinating polyneuropathy. It is neurological disorder characterized by progressive weakness and impaired sensory function in the legs and arms due to damage of myelin sheath in peripheral nerves. Next, Guillain-Barré syndrome. It is an autoimmune disease causing weakness, abnormal sensation like tingling sensation in the limbs and paralysis. And Lambert-Eaton myasthenic syndrome. It is an autoimmune disorder of neuromuscular junction or NM junction. Variation in plasma protein level of plasma protein vary independently of one another, but in case of several conditions, the quantity of albumin and globulin changes in opposite direction. Elevation of all the function of plasma protein, fraction of plasma protein is called hyperproteinemia, and decrease in all fraction of plasma protein is called hypoproteinemia. Now, variation of the level of plasma proteins are given in this table. Now, let's look at this once. Total proteins means all the plasma protein when is increased or hyperproteinemia when it is increased or hyperproteinemic condition in case of dehydration, hemolysis, acute infection like hepatitis and nephritis, respiratory distress syndrome, excess of glucocorticoid, leukemia, rheumatoid arthritis, alcoholism. And when all the plasma protein are decreased or hyperproteinemic condition, in case of diarrhea, hemorrhage, burns, pregnancy, malnutrition, prolonged starvation, cirrhosis of liver or liver cirrhosis, chronic infection like chronic hepatitis or chronic nephritis. Hyperproteinemia is acute hepatitis and acute nephritis, and hyperproteinemia, chronic hepatitis and chronic nephritis. When the albumin is increased, in case of dehydration, excessive glucocorticoid, congestive cardiac failure, when albumin decrease, malnutrition, liver cirrhosis, burn, hypothyroidism, nephrosis, excessive intake of water. When the globulin is increased, cirrhosis of liver, chronic infection, nephrosis, rheumatoid arthritis, and when decreases, emphysema, acute hemolytic anemia, glomerulonephritis, and hypogammaglobulinemia. And fibrinogen, when it is increased, acute infection, rheumatoid arthritis, glomerulonephritis, myocardial infarction, stroke, trauma, and when decreased, liver dysfunction, use of anabolic steroids, use of phenobarbital, and albumin globulin ratio is increased in hypothyroidism, excess of glucocorticoid, hypogammaglobulinemia, intake of high carbohydrate or protein diet, and when decreases, liver dysfunction and nephrosis. So this is for now. I think we have discussed the plasma protein, all the topic very clearly. If you have any query or any doubt, comment down in the comment section. I will try to reply. Also suggest me in which topic you want the next video, and do like, share, and subscribe for supporting me. Thank you so much, and let's meet in the next video. Thank you.